Hello, everyone. Welcome to the Perinatal Connect video series. Perinatal Connect is a research organization working to improve maternal mental health during the perinatal period. The purpose of this video series is to highlight community services in the local area that are helping support families, during COVID and regular times also. My name is Rachel McKinney. I am the mother of three. I teach childbirth classes and am a doula in our community. I'm also a patient participant in the research group. This is Ashley. She is a nurse at Carle, and she's here to share information about the programs at Carle, Healthy Beginnings and Family Foundations. And I'm just super excited to share this resource with everyone because they're just doing amazing things out in the community and supporting lots of different kinds of families. So Ashley, please introduce yourself and share what Family Foundations and Healthy Beginnings are up to right now.
Sure. So like Rachel said, my name is Ashley. I'm a mother of two, since we're sharing. And I have been a nurse at Carle for about 10 years, always a maternal child. So I started off with labor and delivery. And then I have most recently moved to the Healthy Beginnings and Family Foundations programs, really just because it spoke to me. Really getting to work with families outside of the walls of the hospital and helping kind of improve the lives of the entire family. So I'm so glad to be here and so happy to share our programs with you. So like Rachel said, we have Healthy Beginnings and Family Foundations. Both are home visiting services that we offer, really with the goal to connect moms and babies to community resources and provide additional support. So I'll start with Healthy Beginnings. Healthy Beginnings is our program that is more long-term. So we typically start our relationships with mothers early in pregnancy, and we stay with you until the child, the index child that we call them, is 2 years old. So that is a very long-term relationship. Usually moms are referred by their healthcare provider. Sometimes mom will call us and ask to be a part of our program. We've been around long enough that it's kind of word of mouth. So we get those referrals many different ways. We are kind of all employees of Carle, but we are not only servicing patients of Carle. So we are servicing the entire community. And so, like I said, that relationship starts pretty early, and then we continue for 2 years after the pregnancy. It is a voluntary service, and what we provide is pregnancy education, postpartum education, and then newborn toddler education and support. It's not limited to that, though. We work with your healthcare providers, but we also work with the families, again, to kind of familiarize themselves more with community resources. So if that's related to kind of housing or resources for paying bills, obtaining a job, going back to school, all of those things we can work with mom. We definitely provide mental health services even within our program, and then work to link moms or families, members of the family, to outside services. So that's kind of the nuts and bolts of it, and really the major difference being that it's a long-term service. Family Foundations is our other home visiting program. It's a very short-term relationship, and we're really kind of hoping to catch everybody else that we're unable to catch through Healthy Beginnings. To be a family in the Healthy Beginnings program, you do have to meet certain criteria, but we just say, just ask, because if we can't take you, we can offer another service, either be that Family Foundations or connect to some of the other home visiting organizations in the community. But Family Foundations is, like I said, a very short-term relationship where we have a nurse of ours come and see mom and baby and family in their homes for 1 to up to 3 visits just in the postpartum period. In those visits, we are, doing weight checks, we're doing vital signs, we're doing anxiety and depression screening. Again, all that we do in Healthy Beginnings, but it is a little bit more focused, and then really kind of, tackling these as they arise, and really importantly, connecting to, again, additional resources in the community, because that's kind of the end of our relationship. So really working to identify, and see what other needs are, and then linking them to that. So those are really the major differences all nurses in both programs. In both programs, every nurse is a certified lactation counselor. So breastfeeding support is there, but we will help you feed in any way, whether that be breastfeeding, formula feeding, and making sure that, you're doing that safely. And then let's see, we have a lot of background within our nursing team, mostly maternal child. So a lot of your nurses were either OB, L&D, pediatrics, but we do have some nurses with backgrounds in mental health, emergency department. So recognizing those chronic conditions. So we have a variety of knowledge within our teams that has only been proven to be beneficial within these home visiting programs. So again, those are the nuts and bolts of it. We always say, if you have any questions, just call us and we'll kind of see where you can fit.
Yeah, I mean, those are services that I think are missing, that are filling in these big gaps that we have in some of this support that we need, especially now. I know that home visiting stuff has kind of changed as COVID's kind of gone up and down, but we still need those services, and some people don't want family to come, or kind of have some more at-risk family members. So including that in your support hasn't been an option really for parents this year. But it sounds like you guys are able to kind of fill in some of those gaps as needed.
Yes, we are rolling with the punches, and I say home visiting very loosely, especially with COVID. Our goal is to keep our staff safe, our families safe. And with COVID, we are leveraging telehealth or phone and FaceTime visits, Zoom calls like you and I are doing today, so that we can continue to provide those services. And so, just because we're in COVID, and it doesn't mean that anything has changed, it just looks a little bit different. So we are really, really, striving to continue to offer the same quality of service that we always have, even, outside of the times that we're experiencing right now.
Yeah, so being able to kind of check in via phone or video chat is a great way to still be able to use some of those services and know that there's somebody there to support you when you need something.
Absolutely.
Yeah.
Absolutely.
Awesome. Well, it's been great to learn about these different services. I'm so happy that we had a chance to chat. I had not heard of Family Foundation, so it's one of the newer programs that you guys are offering.
It is. We just started that program in November. We did have a lull in that program due to COVID, just because that relationship does really start inpatient. So this program is more focused for moms who deliver at Carle. So needing to get in there to meet these moms is where we do that enrollment. So that's kind of where we like I said, had like a little lull in our services, but we really picked back up in June, July, and are working to continue, not have that kind of regression that we saw, back in early COVID.
Awesome. Great. Well, hopefully, we can get some people, some extra patience for you to really get to have some of that support. So we appreciate so much what you're doing, and we'll get your contact information so that way people can reach out when they need to.
Yes, we are ready for you.
Awesome. Great. Thank you so much.
No problem.